Welcome back to Living Local. COVID-19 infections continue to climb nationwide, and while updated vaccines are available, there is a growing confusion over who is eligible for the vaccine. The FDA has limited who can get the new boosters and is now encouraging people to consult with a healthcare provider.
And former U.S. Surgeon General Dr. Jerome Adams explains what we need to know about the new COVID-19 vaccine recommendation in this segment sponsored by Moderna.
Former U.S. Surgeon General Dr. Jerome Adams explains what we need to know about the new COVID-19 vaccine recommendations.
The big change is that instead of recommending COVID-19 vaccines for all adults, ACIP now advises what we call shared clinical decision making. That means it's up to patients and their healthcare providers to together decide, based on individual risk, whether or not someone should be getting a COVID-19 vaccine. They can help you assess your personal risk and decide what's right for you and your family. But I want people to know that the data still strongly supports COVID-19 vaccines. Over 70% of adults have one or more risk factors for a negative outcome from COVID. Last year, COVID-19 killed more people than breast cancer and car wrecks. And your level of risk may not just be about how healthy you feel. If you're a bus driver, if you're a teacher, if you're a healthcare worker, your daily exposure is going to be very different from someone who works from home.
Dr. Adams says some people may require a prescription for the vaccine, but most of us will still not need to pay for it.
Unfortunately, it is true in some places, and that's part of the problem. ACIP did not recommend getting or requiring prescriptions. But because of unclear federal guidance and this patchwork of state rules, access can vary by age, insurance, state, and even which pharmacy you visit. If you're 65 or older or you have an underlying condition, you should still be able to get vaccinated without a prescription. But if you're younger or you're in a lower risk group, the process may become harder. For most people, you will be able to get a COVID-19 vaccine at no cost. All of the major private insurers committed to covering all ACIP recommended vaccines, which covers about 315 million Americans. Public programs like Medicare and Medicaid will continue covering COVID-19 vaccines, as well as anyone who has an ACA marketplace plan.
Learn more at cveep.org/vaccine-locator.
And again, this segment was sponsored by Moderna. And for more information, go to cveep.org/vaccine-locator.
And we'll have all those details posted at ourquadcities.com.